The results after a hair restoration procedure are permanent, given the fact that the doctor that performed the procedure was technically adequate, experienced, and used the so-called permanent donor area, the permanent hair of our scalp. Worldwide, most protocols, post-operative protocols after a hair restoration procedure include conservative treatment in different ways. The main reason is that hair loss itself is an ongoing procedure. That means that you're trying to restore what has been lost already, but at the same time, you must do your best to keep your own hair, the existing hair. So, in my opinion, the best combination after a hair restoration procedure is to have the new hair, the implanted hair, and at the same time have a kind of conservative treatment trying to keep the existing hair. Many patients trying to find the best solution for their hair loss problem, they make certain mistakes worldwide. First of all, they trust magical treatments, so-called. Unfortunately, there are no magical treatments. The only proper way to treat hair loss is, at the moment, the surgical techniques we have described. AVUT or strip technique and AVUE. There are no magical potions or lotions. At the same time, by choosing the proper hair restoration doctor or the proper hair restoration clinic, patients must be very careful. You have to choose an experienced doctor with the knowledge, medical knowledge, with the expertise, either a plastic surgeon or a dermatologist devoted in hair loss restoration, and also to choose the proper technique. There are advantages and disadvantages in each technique, and the person involved has to weigh all the options before deciding. The objectives of a hair restoration procedure are basically three. First of all, is to do no harm. That means to have a procedure to solve our aesthetic problem, our hair loss issue, without suffering any consequences or any side effects. The second objective, but equally important, is the natural look. We must have a natural effect as a final result of our hair restoration procedure. Third, last but not least, is that we should try to achieve the maximum possible density per session after a hair restoration procedure. With modern techniques and in the hands of an experienced doctor and an experienced team, the success rates after hair restoration are quite high. Actually, we can exceed 90%, we can reach up to 100% success rate after hair restoration. Hair restoration procedures nowadays are very safe, especially the FUE technique, follicular unit extraction, which by definition is a minimally invasive technique that does not need any cutting, any stitching, does not have any permanent scars, is a very safe technique that anybody can use, provided that the specialist, the doctor, has done the proper diagnosis and the proper selection of patients. Averagely, we could say that to have a nice aesthetic result and nice density, we need 2 sessions. This doesn't mean that there aren't any patients that require only 1 session to achieve their goals or to have a nice aesthetic result. Also, there are patients that may need more than 2 procedures to achieve this. It largely depends on the progress of hair loss, where we started from and what we want to achieve, the age, and most importantly, what we have available in our donor area. Speaking of donor area, the hair that we can use in hair restoration is our own hair, and they come from a certain area of our scalp, measuring from the back of our ears to the occipital area in the back, which is the so-called area of permanent hair, and serves as the best possible donor area on our body. We use only a small portion of the available hair for hair restoration, And if this area is not enough or it is exhausted for any reason, we can use, with a new technique, with follicular unit extraction, also other areas of the body. Preferably the beard hair, which are quite strong, and also body hair from different areas, mainly the chest area.